Welcome. Namaste. My name's Calyn and I will be guiding you through a prenatal practice today. A prenatal practice for lower back pain, sciatica, any SI issues. So you might be experiencing these in your pregnancy due to hormones, due to the way you're carrying yourself in your posture, or to the extra weight that you've put on. So sometimes it's unavoidable to get these pains, but yoga can definitely help with that. So we'll be starting in a comfortable seated position on our mat. If you want to grab a blanket, you can have a blanket handy. It's not going to be necessary for the class, but it might be nice for some people to have. So if you want to pause and gather that, or grab anything you need to make you more comfortable, and come into seated. So you can have one foot in front of the other, seated, or just in a regular cross-legged position, kneeling, anything that makes you most comfortable. Just close your eyes and we'll take a couple moments to connect to our breath. Let's take a few long inhales and exhales. And just bring your hands to baby, to your belly. And with every inhale, really feel the air expand around your womb. And with every exhale, allow your shoulders to relax, body to be soft, yet supported from the earth beneath you. Inhale, feel the belly rise up like a balloon. Exhale, let go of any stress, any anticipation. Just a few more rounds. Gently open your eyes. Just bring your hands down to your legs or knees, wherever's most comfortable for you. And really bring your awareness to your pelvis. So you can even feel the bones out in front of you, and then notice your sits bones beneath you. You can move the fleshy part out from underneath you so you're really rooted down into the earth. So notice the whole bowl of the pelvis. You can even close your eyes and just visualize how this works, how it looks in your body as you're supported by the pelvic floor beneath you, holding all your internal organs in and giving that support to baby. So we're going to start to tilt the pelvis forward and then roll back so the tailbone is coming underneath you. Inhale, come forward. Exhale, roll back, tailbone underneath. So you can even tilt forward and then tilt back, moving with your breath. Really just isolating this movement in the pelvis. If any other parts of your body move, that's fine too, if that's just something that naturally moves for you. And you can come back to neutral and we'll just wake up the rest of the body with a couple movements. Inhale, arms rise up to the sky, gaze comes up, palms together. Exhale, hands down through heart center. And then you can bring your hands down to either side and slowly turn to the right hand side. So we're really opening in the front of the body, but we're twisting. So we get a nice release in the back, in the spine. And slowly come back through center all the way to the opposite side. Your shoulder can come back behind you, broadening through the chest. Slowly back to center. Rock forward onto your hands and knees into a tabletop position. And you can have your blanket handy. You may want to use this. We're going to be coming into child's pose, which is a really nice release for the lower back. Bring your knees at least hip distance apart, but for pregnancy, you'll probably want them as wide as the mat, just to make some space for your belly. Bring your big toes together, send your hips over your heels, and start to walk the hands forward and melt down towards the mat. So you have a few options here. It's nice to have the forehead grounded. You can stack fists, place your forehead there, stack palms, forehead there, place the blanket under your forehead, or extend your arms forward, forehead to the mat. If you have a lot of space between your hips and your heels, you can take your blanket and just place it there for a bit of support. So really allow the hips to be heavy and allow the whole body to soften. And take a releasing breath. Inhale slowly through both of your nostrils. And exhale, let it out through the mouth. You can start to lift your head up off the mat from whatever position you're in. And then we're just going to move it to the side. Walk the hand slowly to the left-hand side. So you're really opening up in the side of the body, and you may feel this in your lower back as well. Come to center all the way to the right-hand side. So just to a depth that feels appropriate for your body. And walk the hands back to center. Slowly walk them closer to you. You can bring your knees closer together. Just come up for a moment, move the blanket to the side. You may want it handy. For our next position, we'll be coming to sit on the side. So come down and sit on the left-hand side to start, and there's going to be a few options here too. So if you want your blanket under the hip for a bit of padding, that's one option. You can always also use it for the upper body for some support on the arm or the shoulder. So your feet are going to be in line with your hips and you're stacking the knees. You can stay with the support of your left arm here. We're going to the left-hand side to start, and then have your right hand to the ground. If you don't want to stay lifted like this, if you do stay lifted, broaden through the chest and really stay supported. Or you can lengthen the arm out so it's a bit more relaxed, or use your left hand to cup the side of your head or anywhere on your skull. So I'll choose this variation today. And then we're bringing the heels together. Feet are right together and still having that alignment with the feet to the hips. And then slowly inhale, bring the knees apart. Exhale back down. We'll take a few rounds. And try to keep your torso and upper body in a neutral position. So that should be about 10 rounds. And then you can start to bring your feet away from one another. So your right leg is up in the air. And then imagine there's a doorknob right in your hip crease here. So you're going to go close the door and open the door. So finish up 6 rounds, and then you can start to extend the leg up to the sky. Bring your hand to your leg, anywhere on your leg. It can be in the back of your leg or further up. Just keep the leg extended for a few breaths. If this is really affecting your hamstrings, if your hamstrings are really tight, just bend into your knee a little bit. Slowly release down. With the support of your hands, come back up into a seated position, and then we'll move to switch sides. So we'll be coming to the right-hand side, or if you did the opposite, just make sure that you're keeping yourself balanced on both sides. And then feet in line with the hips, knees stacking on top of one another, and then choosing if you want to stay up, if you want to extend the arm down, or have a bit of support of your hand. Usually recommended to do the same variation on each side just to keep things even, but just be mindful if you've had any sorts of injuries. And I'll stay in this position just to show you another option. So bringing the feet together, inhale, open the knees, exhale down. So we'll take about 10. Great job. And then you can start to bring the leg up and then imagine that doorknob there again. So you can start to close and open. And this doesn't have to be a big movement. See how it feels for you. It can be really tiny. It's getting right in there. So just allow it to do its work. We're taking 6 of those. 6 or so. When you're done, you can start to come up with the support of your hands. And we'll make our way into a tabletop position. Just move your blanket out to the side. And spread your fingers wide apart to create a strong base on the mat. And we'll take a few breaths here. If you prefer tabletop position, you can stay here, or we'll come into downward facing dog, tucking the back toes under, lifting the hips up to the sky, and just opening up the body by bending into one knee and bending into the opposite knee. And come into stillness for 2 breaths. Hips are coming up towards the sky. And slowly lower the knees down to the mat, so back into a tabletop position. You can tuck or untuck the back toes to see how that feels on your knees. You can always use your blanket for padding under any parts of your body, so knees, even under your hands for your wrists. And then we're stacking the wrists under the shoulders. And hug baby back towards your spine. And step forward with your right foot, stacking the knee joint on top of the ankle joint. So just make sure that the knee isn't coming too far forward. You want the support of the joint beneath to just keep some protection for the knee. Really press the sole of the right foot down into the mat, and then you can start to make your way up, bringing both hands on top of the right knee. If you have any pain in your knee, place your blanket there. You can also tuck your back toes under, come back up. Keeping the toes tucked under is really nice and stabilizing for the pelvis. So that's really great when we're pregnant because our body is producing more of the hormone relaxin, which is great for childbirth, but it can make your body a little bit unstable. Slowly bring your hands down to the mat. I like to untuck the toes here and start to straighten the front leg. Hands can walk back a little. Your leg doesn't have to be completely straight. If you want to take a couple breaths with the bent knee first, you can start that way. We'll do both of those one more time. So coming forward, I like to tuck the toes under here for the stabilization. Bring the hands to the knee. And if you'd like, you can also bring your hands to your lower back and open up in the chest. Slowly release back down. Bring the hips back, straighten the leg. And then plant your hands down. Bring your right leg back into a tabletop position. Just rock your hips side to side. Moving to the opposite side, bring the left foot forward. Stacking the knee on top of the ankle, really press the sole of the foot down. You can even spread your toes wide apart so they're really rooted down. Slowly come up. You can tuck the back toes under. And really press the ball of your back foot down into the mat. And come down to the mat. Untuck the back toes. Start to straighten the leg. Bring the toes up off the mat. Hands can come closer to your body. Just go to a depth that feels right for you. If you have blocks, this is a really nice place to use blocks too. And you can always have that bend into the left knee if that's best for you. Stay in tune with the rhythm of your breath. And slowly walk forward. Come all the way up. Option to bring the hands to lower back here. You can tuck the back toes under. Open the chest. And slowly release down to the mat. And one more time back. And then plant the palms down to the earth, back into a tabletop position, rock the hips side to side, or any sort of movements that feel nice as a release in this moment. You can come all the way to sitting on your heels, and then come to sit on one side. So you can sit right onto your sitting bones, and then bring your hands down by your sides. And just try to feel the stability from the earth as you press the full palms down into the mat. Bend into the knees, soles of the feet to the top of your mat. And just close your eyes for a moment here. Really use the entire duration of your breath to fill up in your body into belly. And with every exhale, softening, slowing down. And you can come forward a little bit and bring the right foot just above the left knee. And just see how that feels. You can even rock a little side to side. And then bring your hands down beside you. And breathe into sensation. You can bring some awareness to your foot, so spread the toes wide apart so you're still active in the legs. And roll the ankle of the right foot a few times and then lower it down to the mat. Come forward, move to the opposite side. So bring the left ankle just above the right knee. Bring some awareness to your foot and then just see how that feels. Move the hands down to the mat. Keep the chest lifted. Press down into the mat with the palms. And perhaps close your eyes. Roll your ankle. And lower the foot down to the earth. Bring the soles of the feet together. knees wide. We'll bring the feet pretty close to your pelvis. You can open the feet up like a book, open the chest forward. Rock a little side to side if that feels good for you, or if stillness is better for you, stay there. And you can hinge forward slightly. Full, long, deep breaths. Starting to cultivate breath awareness with our yoga practice will be so beneficial to birth. And even just helping to keep you relaxed. Slowly come up. And we'll come down to the left-hand side. Again, same sort of position as we did in Clam. You can use your blanket, or if you have extra pillows, blankets, bolster, anything like that. Extend the arm out. And your lower body can be in any position that you'd like. You can stack the knees, you can straighten the bottom leg, bend into the top knee, or anything that helps you to just settle into stillness for a few rounds of breath. If you have time to stay in final resting pose for a while, please do. Otherwise, you can come with helping hands back up into a seated position on your mat. Just take a moment to ground yourself into the space. Thank you so much for practicing with me today. Namaste. I hope that you can find some relief for your lower back or any sorts of issues that are coming up for you right now. If you can try and do this practice a couple times a week, that'll be really beneficial for you. Or if you want to search on my channel for some more lower back classes, then I do have those available for you. Thank you so much. Thanks for practicing with me today. Hope that you enjoyed this video. If you did, if you could give it a like, comment below, or subscribe to my channel, that will help me to be able to create more content for you. Thanks so much. Namaste.